2 new coronavirus cases have been confirmed here in Singapore. Both patients are Singaporean. One is a 37-year-old Certis Cisco employee who served quarantine orders on 2 people from Wuhan who later tested positive for the virus. He started showing symptoms on January the 31st and went to a GP 2 days later. He was on duty at the Chingay Parade, which took place on January 31st and February the 1st.
The other new case is a 2-year-old girl who was among the Singaporeans evacuated from Wuhan at the end of last month. This takes the total number of cases here to 45. And among those still in hospital, 7 are in critical condition, but 1 more person has been discharged, making it 7 people who have fully recovered.
Researchers around the world are racing to create a vaccine for this novel coronavirus. One Singapore-based scientist who's part of the World Health Organization's Emergency Committee hopes that it can be ready for clinical trials in just 3 months. And Singapore could be a site for those trials. Melissa Goh tells us more.
It took over 2 years to come up with a vaccine for the outbreak of severe acute respiratory syndrome back in 2002. But global bodies like the World Health Organization and the Coalition for Epidemic Preparedness Innovations, or CEPI, are now trying to fast-track a vaccine for the 2019 nCoV. That's according to one Singapore-based scientist who's helping them assess candidates to produce the vaccine.
The new organization called CEPI, their aim is to get a vaccine ready for trial in 3 months. If any vaccine is ready for human trial, we are very experienced in that. So we try to convince the international community to say Singapore should be one of the trying sites. Or affected area like Hubei province, we should vaccinate everybody. And then for high-risk area like healthcare workers, people working in the airport.
While the hunt is on for the vaccine, doctors in Singapore are seeing some success in repurposing drugs, such as the HIV drug Kaletra, to treat severely ill patients. But not enough is known about the effectiveness, and work is also underway to run trials with promising drugs.
The bigger the sample size, the better the resolutions of the study, and we recognize that the fact that we are very keen to have regional international collaborations.
For now, to first detect the virus, Singapore's research agency A*STAR has come up with a test kit.
There are many reports that asymptomatic, no symptom person may be infecting other people. So, in order to find who is a carrier of this virus, is very important to must use the very sensitive detection kit.
A*STAR has also designed another prototype that can test for both the coronavirus and influenza, which share similar symptoms. Currently, patients need to undergo 2 separate tests, which takes time and effort. Scientists here have said they believe the 2019 nCoV is transmitted mainly through droplets. But it's still early to tell if there are other modes of transmission. Experts advise people to wash their hands regularly and to disinfect surfaces. And to help Singapore fight the virus, about 20 confirmed cases have been recruited by the National Centre for Infectious Diseases for a study to understand the nature of the new virus, develop new tests, and to decide what treatments could be effective.